Very excited today to talk to you guys about Elios. My name is Oise, Omoijuanfo. So physicians face several barriers. Howard touched on a little bit on some of them in staying current and skilled for their patients. The first one is the doubling time of knowledge. So the doubling time of knowledge is the amount of time for a body of knowledge to double in size. In medicine, that went from 50 years to 73 days. So, and there's just a ton of information that's coming out, a ton of studies, and also, frankly, a ton of junk studies that need to be sorted through. The second reason is that doctors are often bad at self-assessment. There's a lot of research that looks into this, and when there's an idea that challenges a preconceived notion, it's very hard to get over that and change our pre-existing beliefs. And finally, the third, there's a study that's looked at this. Physicians forget about 50% of what they learn within 8 months of learning it. So there's a massive drop off there after 8 months. Why does this matter? Medical error is a leading cause of death in this country. Obviously, I can't stand here and say that that's only caused by knowledge, but there have been some studies that have looked into this, and there's a significant amount is tied to knowledge. So this is Elios, which is our AI-powered adaptive education solution. It allows physicians to become better doctors, to learn more relevant and personalized content that's created for their knowledge deficits and for their practice, and it allows them to retain information for longer. It allows hospital administrators to more easily upskill physicians, more easily track compliance and credentialing, and reduce legal liability. So when we came to JumpStart, we had the problem. We had our team, which I think is well suited to tackle this problem, but we didn't quite exactly know how we wanted the solution to look like. On the left, you see kind of our flow of how Elios works. You have our educational data or content comes in, then our Elios AI chops it up, it assesses the user, and then it surfaces that content when it's needed in the moment, and then it's able to resurface that whenever a user is about to forget. And this leads to better retention, relevance, and an easier way to learn. Today we have our MVP. It's able to, we're very proud to have it working, and since starting JumpStart, it's able to ingest linked content. Right now that's only video, but our plan is to have basically every other type of learning modality. It's able to assess the information retained of the user, generates a personalized learning pathway, a summary of the lecture or the talk, and then flashcards. In the future, we want to be able to link Elios into any source of education, whether that's research papers, a conference, internal hospital talks, wherever that source may be. We want Elios to be able to plug in, pull in from that content, assess the user, and then surface that content when it's needed. And then we also want to tie it into electronic health records so that can be surfaced in even more relevant contexts. This is our business model slide. So the current expectation is that the hospital kind of pays for tools and education solutions like this. Comparable products are about $500 to $1,500 a user a year. We're coming in at about $600. Our TAM we've calculated by the amount of money that is spent per physician per year on educational context, and that gives us a $4 billion TAM. Our SAM is based on our subscription multiplied by physicians in the US, and then we have our SOM, which is, our subscription, but physicians in the Midwest. Sorry, the SAM is physicians in the United States, and SOM is physicians in the Midwest. So we offer a host of benefits to hospitals that implement our solution. We can expand the scope and practice and upskill physicians. We can improve the quality of patient care and outcomes, and we can reduce legal liability with current and more relevant insights. So there's a lot of products right now that meet the current standard that are in use. A lot of them, frankly, I've used working at the clinic. In my opinion, they're kind of crappy, but they do meet the standard. But they're all based on static and outdated learning theory. They're simply lectures or just videos. Some of these platforms were textbooks that were written 100 years ago. Originally, they're scanned, and then they're kind of turned into a pseudo ebook. So we believe that with our adaptive nature that we can win in this space. I would like to point, this is our team. We're very excited to be working with these people. I'd like to point out my co-founder, not just because we both need haircuts really badly, but because he's a really skilled software engineer, 15-year plus veteran. I worked with him. I've known him since 2011. very excited to be working with him on this. So we have a signed pilot site with a hospital in Arizona. We are currently prepping for a pilot study where we want to compare a group of physicians who use Elios and then a group of physicians who use who use a more traditional course or standard, and then assess the results of that study after it's completed for retention, ease of enjoyment, and some other metrics. Currently, we're raising a $550K pre-seed round. This will allow us to to build tools to connect Elios to other sources, source some of our own, and create some of our own content, continue our deployment of our alpha version, and then convert some of our LOIs to paid contracts. This is our 500K will take us through 2025 and most of 2026, and then help us prep for our seed raise. Thank you all very much for being here, and I'm excited to talk to anybody afterwards.